So the Barrigel study was using a spacing device that's injected between the prostate and rectum to move the prostate about a centimeter or so, half an inch away from the rectum. And that way the radiation would be further away from the rectum, and theoretically you'd have less rectal side effects because you get a lower dose of radiation to the rectum. So patients were randomized, 201 patients randomized 2-to-1 again to getting the Barrigel inserted or not. The goal, first of all, was to have at least 70% or so patients have a 25% reduction in this dose to the rectum. We found that 98% of the patients had more than a 25% reduction in dose to the rectum. So the primary goal was met easily. So the secondary endpoint was toxicity, rectal toxicity, and they found that people getting the Barrigel had dramatically lower toxicity. So instead of 13.8% of patients not on the Barrigel side getting some moderate rectal toxicity, only 2.9% in the group that got Barrigel had the rectal toxicity. And it was pretty mild, but still a pretty significant decrease in toxicity. And I think the third part of this trial is it was hypofractionated. So all the trials we've done before with the different spacing agents were standard fractionation, going for 8-9 weeks of daily radiation, and people just don't do that very much anymore. The standard is to do 4 to 5.5 weeks. So this was 4 weeks of treatment, so much better for the patient to be able to get in and out. And they showed that with hypofractionation that this sort of spacing significantly improves outcomes. Now, what's interesting about the GenesisCare global network is this is not being done just in the US, but it was in Australia and Spain. There's UK people as well. And what we find is that we all have maybe a little different flavor of how we run our clinics, but with radiation, we can do the exact same dosage and meet the exact same constraints and show that internationally we can get the same results. And as the world becomes more globally integrated, I think doing these global studies is going to be more and more important.